Hello, everyone. Here we are at the end of July, and we are about a month away from starting school. Last week, I participated in a Zoom call with about 50 teachers and also two school board members related to an open letter that the board and I had received in which teachers voiced a number of concerns. For example, that we were not going to require students to wear masks or face coverings all day long, concerns about those with significant health conditions, also the fact that students would be together for a long period of time in closed spaces, maybe new research that indicated that the coronavirus would spread through aerosols, so it could linger in the air for long periods of time, and why we weren't, accounting for that. And I want to assure you that all of these concerns were brought to us early. We had talked about the impact that students may have on the spread of the disease in elementary schools, middle and high schools, back in April. That's information we were still waiting on. Also, how the disease spreads isn't really entirely clear yet, but based on what we hear from the research, there's certainly now an investigation into this possibility of aerosol transmission. That's not settled. The World Health Organization, is doing additional research. They're looking at that data. It's always important to understand that there are limitations to even the MIT study that showed, how aerosol particles can linger in the air for an hour or so, that it's really difficult to determine whether what is in the air is actually able to infect others, because that's much less clear. And so we look at all that information and have. And so all the concerns that were brought really have been part of our conversation. And the process, as always, is that we run all the questions, all the concerns we have and that are brought to us by the experts in the field, whether that's an epidemiologist at the Virginia Department of Health, whether that's conversations with specialists in air conditioning, whether that is about cleaning protocols, and also guidance from the CDC, VDH about face coverings. When we think something is simple, just make everyone wear a face covering for the duration of the school day, the response is, well, it's going to be a trade-off. The longer students will have to wear face covering in one stretch, the more likely they are to touch it, the more likely they are to touch their faces. And so disease spread could actually be worse that way. And so there has to be that conversation. And I promise you, we do take your concerns seriously. And we do involve, again, the epidemiologists and other health experts. We've had physicians speak out both in favor of opening schools in a traditional way, but then also those who have suggested we should open virtually. With all those groups and individual physicians, we have follow-up conversations, and I will have follow-up conversations this week again with the Virginia Department of Health Regional Director, an epidemiologist from VDH, but then also a local pediatrician and a local family practitioner to clarify our thinking and to bring those questions back that new research has now created for us. And so I promise you, we don't ignore your comments. And I know one of the comments was that our survey maybe wasn't comprehensive enough, that it should have been more open. But at the end of the survey, we provided an opportunity to write down comments or concerns that the survey didn't address. And more than 700 of you took advantage of that. So we got a lot of information back. It's being read, it's being considered, and again, we look at the evidence. Just as we don't engage in the political conversation, on the side of those that say this is all a hoax, this isn't real. We know it's real. We know it's a global pandemic. We all probably know people that have been infected, what the complications can be. We read about 35-year-olds suffering from strokes. My daughter was positive, and so for a while she couldn't smell anything. She couldn't taste anything, and that's not a good way to live your daily life when you have those complications. And even when it's not deadly, there are serious complications, and we don't know all the long-term effects yet. And we don't know the exact role that children play in the transmission. We've known for a while that children can get infected and can get sick, even though they typically suffer from milder symptoms. That's not always the case. But we haven't been clear on the role of children, especially at the elementary age, in transmitting the disease. We now know that middle and high school students can transmit it, But again, it's not quite clear yet at the elementary level. There's a large study out of South Korea now that indicates it's possible, although much less likely, that elementary students can transmit it. But again, that's something that is still being looked at. And we take those studies very seriously, just as we do all the others. And every component, from how students enter the building, when and where they will need to wear face coverings, what breaks there need to be, what we can improve in our airflow in the building, those are all considerations. And I can tell you that board members have indicated already that they're very open to having stricter rules in many of those areas. And again, it will be based on what we hear from physicians, from the researchers, and from the epidemiologists in the field. So please stay tuned. There will be updates to our plan. They are based on questions you keep asking, so please keep bringing those to us. But again, I also have to reiterate that we have been aware of those, and that really there aren't any concerns that we hadn't heard before. So we have been aware of those, and they've all been part of the conversation. We will push again, in our meetings to get, more solid information. I can tell you, for example, that, currently one of our main concerns is the lack of available testing and how long it takes to get results back. We're not comfortable with that. On the other hand, we are quite comfortable with the trends in the community. So Rockingham County is no longer considered a hotspot, and the disease trend has gone in the right direction. But we're also facing, more than 20,000 college students coming into the area in a few weeks. The Rockingham Fair will still take place, even though at a more limited level. But those are all things we need to look at. And so again, these conversations are ongoing. As you know, Harrisonburg has decided to start the year fully virtual. We don't just follow another jurisdiction, but we have conversations. We had those before the decision was made in the city, and we continue to have those now. So again, I want to assure you that your concerns are taken seriously. We look at what the data show, what the research shows, and then we make a decision. And we know that there isn't a decision that, one, everyone will approve of, and two, that is absolutely the best decision, because there are costs in every direction. Right? We want to focus on health and safety primarily, but we know that if we were to go virtual and protect people from getting infected in schools, there are costs for those whose only caring adult connection is in school buildings. There's a cost for those with food insecurities. There are costs for lack of supervision at home when families make that choice of going to work or watching their kids. And so there is a health cost, there's a safety cost in every direction. And so we have to take that into account. It's not an easy decision. We know it will be unpopular either way, but we try to make the best decision. And your views matter. I can promise you that. So again, please stay engaged, and please keep watching for updates as we find out more and learn more and fine-tune the decision that is yet to come. We have a school board meeting this Monday at Rockingham Academy and another one on August 3rd, and I anticipate that there will be significant conversation around this topic, and again, additional information that we can release and possible changes to our course of action. So thank you for bringing the concerns up, and again, stay tuned, and we will update you as soon as we can. Thanks. Have a great week.